concern that even a single case of Ebola creates on our shores. But we have the public health systems and the public health providers in place to contain the spread of this disease.
Health and Human Services Secretary Sylvia Burwell says that guidance has been sent to state and local officials for Ebola. Joining me now is Dr. Joe Thompson, Surgeon General for the state of Arkansas. Dr. Thompson served as the Chief Health Officer for the state when I was governor. And he and I worked together on a lot of public health issues. Dr. Thompson, so nice to have you. Thank you for joining me. It's good to see you again.
Glad to be with you, Governor.
Let's start out by finding out exactly what kind of guidelines and information has the CDC provided to people like you, Chief Health Officer at the state level.
Well, the CDC has provided to health departments, both local and state, across the nation, several different tools that are very valuable. One is guidance on what to do if there is a potential suspected individual with Ebola exposure or symptoms. And then following through, providing us with information to get out to our providers, both hospitals and physicians, clinics across the state, to actually stimulate the question, have you traveled overseas, and in particular to West Africa?
Do you feel like that the information that you've been provided and that you in turn are providing to hospitals and clinics and other medical professionals in the local community, is it adequate? Has it been presented to you in a timely fashion? Were you prepared for what happened in Dallas?
I think with Ebola, we had an early warning by the information coming from West Africa, so we were aware. I think what happened in Dallas was anytime the first case happens, your vigilance goes dramatically up. So I think after Dallas, providers across the nation, and for sure here in our state, have a much higher vigilance and responsiveness to ask the questions and to assess the patients more accurately.
How worried are you that this is going to spread and we'll see hundreds, if not thousands, of cases of Ebola across the United States?
It's hard to predict, Governor. This virus is less easily spread than the H1N1 that you talked about earlier, but I would not predict that we won't have a few more cases pop up across the United States. I think most of them will be from travelers who've come across that were infected but asymptomatic when they came, and that then the early recognition and the responsiveness of our medical personnel for treatment and our public health personnel for contact tracing and containment will be important to contain this response.
You probably heard the conversation that I just had with former Secretary Michael Leavitt. You remember the bird flu scare, the H5N1 pandemic that we were all really afraid of, and frankly, we thought it was coming, and we maybe over-prepared for that. Let's just act again as if we're at a press conference, and I call you to the podium, because I did that several times. But let's pretend that that's what we're doing right now, and I say, Dr. Thompson, please come to the podium and tell the people of our state what they need to do, what they need to prepare for. What would be your message to them?
My message would be we have a new threat in the United States, not yet in our state here in Arkansas, but a new threat that has emerged, like many more will come and that we've had in the past. The most important thing for an individual to do is actually wash their hands several times every day, not only for the Ebola virus, but also for the common flu, which is starting later this month. Keep yourself healthy, stay active, stay aware, and don't panic. This is an important exposure, but yet we have systems in place with our medical personnel and our public health personnel to help contain it.
You know, a lot of emergency room nurses are really frightened right now. There was an article in Business Insider this week that hospitals feel like that they weren't adequately notified and maybe aren't fully staffed, prepared, and, you know, people are coming into the emergency room. Is there a danger that nurses are going to say, look, I'm not touching that person until we know more?
Well, I think that's where putting the question in the sequence before you actually get to the examination of the patient is important. Have you traveled outside of the United States? Question number one. If the answer to that is yes, have you traveled to West Africa? If those two questions are yes, then a whole new set of procedures should be put in place before you actually get to the examination and the touching and exploration of a patient's physical well-being.
Well, I tell you what I'm going to do. I've already got my flu shot. And as soon as we take the break, I'm going to go wash my hands again, just so I can be because I don't know about this audience. I'm not sure about them. Dr. Thompson, great to see you again. Thank you very much for very practical insight on the Ebola crisis.
Thank you, Governor.